For doing your testosterone cypionate and your MIC B12 complex, known as Ultra Slim, this is called an intramuscular injection. So to get ready to go ahead and prepare to do these injections, go ahead and take the medications out of the protective vials. And for illustration purposes, we're going to go ahead and do a testosterone injection. Step by step, protocol by protocol, everything is identically the same for doing the injection for both of these medications. So at this point, go ahead and put your thumb on the protective cap on the testosterone and pop that off. For this injection, we're going to be using the 23 gauge 1-inch needle. Go ahead and give that protective sheath a twist to make sure the needle is on very tight. At this point, our goal is to inject 1 milliliter of testosterone cypionate. So like always, we want to go ahead and equalize the air pressure. So go ahead and use this needle and pull the plunger back exactly to 1 milliliter. Go ahead and put the needle into the testosterone and push in the air. Invert the needle and the medication and slowly go ahead and pull back exactly to the 1 milliliter mark. Now you'll see that testosterone is made with an oil base and it passes through the needle very slowly. What I've done here is I actually pulled the plunger back to about 1.5 cc's, and you can see that very slowly the testosterone is filling up in the syringe. Once you start getting closer to the top of the syringe where it looks like it's just about full, what we can do is go ahead and slowly start to push the plunger upwards. And you'll see that there's a tiny air bubble that's stuck at the top. By pushing the plunger upwards, all of that air is pushed completely out of this injection, and your plunger will be right at the 1 milliliter mark. Now, one thing that I want to show in exquisite detail to make sure you understand is how to measure a 1 cc or a 1 milliliter injection. When you look closely at the needle, you'll see that there is a concave point on the inside top of the plunger. The purpose of that concave point is to compensate for the solution which gets stuck in the needle and at the top of the syringe. In other words, to properly measure the correct dosage, you want to use the first black line, and that black line is the top of the plunger, where it's the first point where it actually touches the inside of the glass. Looking closely, you can see that the black line perfectly measures up with the 1 cc mark, but on the inside of the 1 milliliter mark is the concave point. And again, the proper way to line this up is at the first line underneath that point where the plunger first touches the inside of the syringe. Once you've established that that is correct, go ahead and invert the testosterone, remove the needle, and you're ready for injection. I'm going to demonstrate how to do a testosterone cypionate injection. The first thing you want to do is, of course, being sterile. You want to take your alcohol swab and you want to clean off the place that you're going to do the injection. Now, the injection is done on the upper outer area of the buttocks. Before I clean the injection site, I want to explain to you where this is approximately done. There's two visuals I want to create that you can see on the diagram. The first visual is if you look at one side of your buttocks and you're to cut the buttocks into 4 quadrants, you do so by putting a plus sign through. You want to make sure that you do the injection in the upper outer quadrant. Another way to think of it is if you have a pocket on the back of your pants, you want to use the upper outer corner of the pants pocket, which is closest to your hip bone. The reason that I explain this in such detail is that down the center of the buttocks, there is something called the sciatic nerve. If you hit that nerve, it won't do any permanent damage, but it definitely won't feel good. It can cause a lot of excruciating pain. And it's very difficult to hit, so you don't have to worry as long as you follow these simple guidelines. So on that note, thinking of the upper outer quadrant, I'm going to go ahead and use my alcohol swab and clean off the proper area at the top. Now, when doing the injection, it's a lot easier than it seems. The first thing you want to do is stand with your shoulders squared off to your feet. Now, I'm right-handed, and I'm going to do this injection on the right-hand side because it's easier for me. Now, what I'm going to do to reach all the way back there, I'm going to spin the upper half of my body clockwise to my right. And as I turn to my right, all of the weight shifts to my left leg. Why that's important, because now the right leg, or the leg on the same side of your injection, is going to dangle loosely. To make this injection simple, moral of my story is you want to make sure that you are relaxing the muscle in the buttocks. If you tighten it up and you get nervous, you might feel a little bit of a pinch, whereas if you're nice and relaxed and that muscle is nice and loose, it's going to be very, very simple. So at this point, you want to hold the syringe with a fist. You want to grip it nice and tightly. And you're going to use the strength in your thumb to go ahead and suppress the plunger. Because remember, testosterone is an oil base, and it takes a little bit of pressure to push it through that small needle. So at this point, I'm going to go ahead and expose the area. Tight grip on the needle, upper outer quadrant of the area, and quick in, one shot. Push in the plunger, take your time. Done. Very simple, very painless, easy to do. Take your time and relax, and it's very easy to move forward. Now that we've completed our testosterone injection, we want to go ahead and clean up the mess. Go ahead and put the protective cap very carefully back onto the needle. Unscrew the needle off the plastic syringe. Take that needle and dispose of that in your sharps container. The remaining plastic syringe, the caps, the covers from the medications, your alcohol swabs and paper can all be disposed of in the garbage. Please remember, these instructions apply exactly the same to both the B12, which is the Ultra Slim Shot, and the testosterone cypionate. When you're done with these medications, they're stored in a cool, dry place like a kitchen cabinet. Keep them away from direct sunlight and do not put them in the refrigerator. These do not need to be chilled.